Good afternoon, good evening, good morning from wherever you are. My name is Sponsor Pilani, and I had the pleasure of taking you through day one yesterday of our global lecture series and engagement. I'm so glad to see some familiar names in the attendees and participation list. Welcome back and welcome to all our new participants. As I explained yesterday, that the African Alliance, the Vaccine Advocacy Resource Group, the VARG, the Global Network for Young People Living with HIV, and the Ready movement have brought you this lecture series focusing on the 4 pillars that will be discussed at the International AIDS Society's COVID-19 conference titled Prevention. As we know, the IAS will be hosting the COVID-19 conference prevention and will feature the latest and all the brand new research in prevention related science, policy and practice in relation to COVID-19. Of course, the conference will take place virtually on Tuesday, the 2nd of February, and it will include invited speaker sessions, abstract presentations, and a lot of discussion. This is during a time where the world, all the scientists across the world are trying to develop vaccines for COVID-19. The conference will also examine all the aspects of SARS-CoV-2 infection prevention, including non-pharmaceutical interventions, which is the first lecture we're going to have today, active and passive immunization, as well as other related science, as later on we will have a lecture on basic science. Today, we have the pleasure of starting with Dr. Sibusiso Mkwananzi, who will be taking us through a lecture on non-pharmaceutical interventions for prevention. But before we get to Dr. Sibusiso's presentation and lecture, I'd just like to welcome everyone and remind everyone that if you would like to attend the conference, the IAS conference that's taking place next week, Tuesday, you have a once-in-a-lifetime opportunity to do so by filling in our pre-survey. That's really just asking you what are your expectations for our workshops, and if you fill it in and you fill in the one that I'll send later this evening, you could win yourself a free ticket to the conference. We're giving away 10 free spots. There'll be a draw at the end today after the lecture is done, and we will then inform the winners by email so that they can claim their ticket for the conference next week. So I am posting in the chat yet again, just like yesterday, I am putting in the chat the link to the survey, and please do take the time to fill it in and wait for me to share the other link later, a little bit later today, to stand a chance of winning. Now, without further ado, and just so that we can get into the business of the day, as I said, Dr. Sibusiso Mkwananzi is going to be giving us a presentation on non-pharmaceutical interventions, COVID-19. Yesterday, we had the pleasure of listening to Dr. Nyaradzo and Dr. Jennifer Maroa, who focused on vaccines. Dr. Nyaradzo gave us a very interesting and incredible presentation about vaccines, the science behind vaccines, how they work, and everything to do with them. And then Dr. Maroa took over from her and continued the conversation around vaccines, but we focused on global policy and access. We looked at issues around what kind of policies exist in the world that enable pharmaceutical companies to hike up prices, patent laws, and also talked about the potential that the global south and continents like Africa have towards ensuring that in the next pandemic, because research is showing us that there may be others in the future because of global warming, we are more prepared to make our own vaccines or our own medicine. So today we're talking about the non-pharmaceutical non-pharmaceutical interventions. And these are really that have nothing to do with the medicine, the vaccines. And Dr. Sibusiso Mkwananzi will explain it in further detail. I just want to tell you a little bit about her before she starts. Dr. Sibusiso Mkwananzi is a demographer, and she is a senior researcher with a background in health. She holds a PhD in demography, a master's in epidemiology and biostatistics, as well as her undergrad degree in dentistry. Her interests lie in the application of quantitative research methods to traditionally qualitative approaches for issues such as gender, intersectionality, sexual and reproductive health and rights, gender-based violence, development, as well as the nexus of social and health and wealth phenomena. There is no better person who can give this presentation except for Dr. Sibusiso Mkwananzi, who I'd like to welcome. Doc, welcome. Thank you so much for joining us.
Thank you so much, Bonzo, for having me and for inviting me to this panel. It's an incredible honor, and thank you for the introduction.
So I'm just, once you've started sharing your screen, I'm going to get out of the way. My 2 minutes of fame are done. I've done the introductions, and you're the main, you know, if you go to a concert, every time before the main act, some of the smaller artists perform. So that was my duty today. I was the opening act for your main event. So I'll let you get on with it. And I am just on mute and off camera, but I will be listening attentively. Please do remind also just as I wrap up, to remind our audience and our participants to send questions in the Q&A, to raise hands. Dr. Sibusiso is looking forward to all your questions. Thank you. Go ahead, Doc.
Thank you so much, Bonzo, and welcome to everyone who has joined us for this, our second day, in a really important engagement with community members, activists, and other organizations that are working in this space. So my presentation today is entitled COVID-19 Non-Pharmaceutical Interventions. And just to say that, I really have found just preparing for this lecture to be really valuable, because I think this is a part of the strategy against COVID-19 that really needs to be looked at and really needs to be understood. So I really am glad that I'm going to be sharing it with all of you today. So let's get into it. So just by way of introduction, we all know that the COVID-19 pandemic remains a health challenge of humanitarian proportions, global proportions, and it continues to be a health challenge, but many of the challenges have also overspilt into other areas of people's lives. And the devastating effects of COVID-19 have been evidenced globally across all sectors, particularly health and the economic sectors, but other sectors have also ended up being affected quite gravely by COVID-19. So as of the 28th of January, 2021, I'm a demographer. I like working with the most current figures to an era at times. We had over 100 million COVID-19 confirmed cases that had been reported to the WHO. And we had over 2 million deaths that had been reported as of yesterday. So those are very, very high numbers occurring globally. And measures to combat COVID-19 have really been twofold. On a more minor level, there have been the pharmaceutical interventions, and they've been more minor because COVID-19 was a new disease. Yes, people are saying that it was very similar to previous diseases such as MERS and SARS, but it as an entity was quite new. And so the diagnostics and testing around COVID-19 had to be developed quite quickly, and they were developed actually very quickly, it being so new. Therapeutics, previous medication that has been used for other Illnesses have now been applied to COVID-19, some successfully, some not so successfully. And, it's really a chance thing, but what we are really hoping for is that these vaccines that have recently come into circulation will be effective, and we will be able, hopefully, to get herd immunity through these vaccinations. But because COVID-19 is such a new disease, these pharmaceutical interventions are really very experimental. They've had errors even with the diagnostics, with the testing, with the tests, with high false positives, and so because of that, the main the main measures that have been used to combat COVID-19 have really been the non-pharmaceutical interventions, and so that's what I'm going to cover today. So what are non-pharmaceutical interventions? And basically, these are actions that people and communities can use to help prevent or limit the spread of illness. Okay. Right. So a study, a presentation actually by Karim and Karim last year, looked at the various lessons that can be learned from HIV for the COVID-19 response. And many of these lessons actually speak about the non-pharmaceutical interventions. Okay, so 10 lessons that they shared were that there needs to be a centrality of scientific evidence in the response, that whatever we do, it needs to be grounded in scientific evidence. The second thing is that leaders needed to be consistent as role models, so as the public can see the good things that are being done and not end up being led astray, okay? In addition to that, another lesson was that it was important for policymakers, health practitioners to know what kind of epidemic they were dealing with. And if they knew what kind of epidemic they were dealing with, then it was going to be easier for them to know the most appropriate response for the epidemic. Another lesson was that testing was very, very important. It was important to have a rapid test, a rapid point of care diagnostic, okay, a test which was going to end up having results quite quickly. And the fifth lesson was that it was important to try and stress mutual interdependence for individuals in the community to know that we have to work together to overcome COVID-19, okay? So I'm going to speak about that a little bit later on. But something that was also a very important, a valuable lesson was that there was this prevention toolbox, which was essential. So it's not that there's a silver bullet for COVID-19, just like there wasn't a silver bullet for HIV, but there is this toolbox of prevention tools that needed to be used in conjunction with each other. There was, of course, a challenge of behavior change. There's always a challenge with behavior change. I'll touch on that as well, because we're humans, because we are so used to habit, we're used to doing things in a certain way. And so when we have to change our behavior, that can become quite challenging. And what is important in this whole process is that there has to be community engagement. You have to have community engagement. You have to have community buy-in. Otherwise, people are left behind. And when people are left behind, they actually do not end up implementing what you need them to implement. Another very big lesson was that it was important to address gender inequity. Inequality is a big thing that we've seen through COVID-19 and through the COVID-19 response, that it's easier for certain people to implement even many of these non-pharmaceutical interventions, and I'm going to touch on that as well. And finally, it was really important for us to try and strive for universal healthcare. We saw with HIV that there were certain groups that were affected more than others, not necessarily because their behavior is different, but because even in the midst of similar behavior, access to healthcare, access to treatment, access to, all sorts of things has been different based on people's ability and access to resources. And so in the very same way with COVID-19, it's really important to have universal healthcare. Otherwise, people are going to be left behind, and it's going to be a certain group of people, say the same kind of people that are going to continuously be getting sick and eventually even passing away, unfortunately. So I'm going to touch on some of these lessons as I go forward into the lecture. And so I really first want to just talk about this essential prevention toolbox that was suggested, okay? That we need to have an essential prevention toolbox when it comes to COVID-19. And our prevention toolbox for COVID-19 consists of things like testing, isolation, quarantine, and contact tracing, social distancing, hand hygiene practices, cloth masks or masks in general, wearing of masks, and even just simple cough etiquette, lockdowns, okay, the appropriate use of PPE amongst particularly health workers, okay, and frequent environmental cleaning or where people are staying. Okay, so I'm going to touch on some of these when it comes to the non-pharmaceutical interventions. So let's talk first about lockdown, okay. So by definition, lockdown is an enforced compulsory social distancing. Other people call it a compulsory extreme social distancing to break the chain of transmission. So you're trying to break the chain of transmission, transmitting disease from one person to another within communities, okay? And just to talk about the South African case, okay, in South Africa, our primary case or our patient zero was an individual who was returning from Italy, and they were diagnosed on the 5th of March last year, okay. Within 18 days, that first case had increased to 402 cases, okay. And just before lockdown was implemented, the doubling time, so the time it took for a certain number of cases to become double that number of cases had decreased to 2 days. So within 2 days, 402 cases would have become 804 cases, would have become that times 2. It was horrendous. It was just increasing at a phenomenal rate. And just before lockdown was implemented, on that date, we had about 1,170 cases, okay, that had been identified. So we went into lockdown around the end of March, and then we waited, okay, it was a waiting game. Even Prof. Karim at the time had said that all we can do right now is wait and hope for the best. And at the end of April, the doubling time had increased to 15 days, okay, which was very good news, okay, which showed us that, so as much as there's this debate that was lockdown worth it, did we have to do it, etc., etc., the evidence speaks for itself, right? That the doubling time was able to increase from 2 days to 15 days because of lockdown, firstly. And after 15 days, at about the end of April, we were now sitting at around 5,647 cases and 100 deaths in total. So what are the advantages of lockdown? Okay, so the purpose of a lockdown is to reduce the number of people that each confirmed case can infect, all right? And what you're really trying to decrease is you're trying to decrease the reproduction, okay? You're trying to decrease the reproduction of each case to be less than one, right? So each person should be infecting fewer than one other person on average, okay? So even if there might be people that are infecting more than one person, but on average, when you take the complete average, it should be that each person, each case should be infecting less than one other person, okay? And therefore, does the evidence support that lockdowns work, okay? The evidence actually does support that lockdowns work, okay? In China, Germany, and Spain, a fall in infections were noted after the implementation of lockdowns. In addition to this, there was a study in China that showed that doubling time increased from 2 days to 4 days. Even in our South African case, we saw that our doubling time increased from 2 days to 15 days. So we even fared better than China, okay, for this particular period, okay? And in Italy, they found that 200,000 hospital admissions were actually prevented, okay, due to the lockdown, and the virus transmission had been reduced by 45% due to lockdown. So there's definitely evidence. Studies have shown that lockdowns are advantageous and that there's evidence to support that they do work, okay? But of course, there are disadvantages, okay? As much as various countries have gone into lockdown, it is impossible to eliminate COVID-19 completely through going into a lockdown. And so a second wave, sometimes a third wave, is even possible, okay, and will happen due to restriction fatigue. When when the lockdown is lifted, people are so tired of having been restricted for so long that what do they want to do? They want to be free. They want to do what they weren't able to do before. And so sometimes people might overdo that, okay, especially when alcohol has also been introduced back into the system. That everyone wants to, go back to having a normal life, to having fun, to being with people, to being with friends. And this, unfortunately, will then lead to a second wave. Okay, it's inevitable. All right. In addition to this, lockdown has the disadvantage that it does lead to economic downturn. Okay, there are huge damaging economic consequences. Okay, and some countries have even gone into recession. Okay, businesses have closed down. Even in South Africa, the unemployment rate has increased, and with that, then also the levels of poverty also increased. So there are definitely disadvantages for lockdowns. In addition to this, there were even disruptions with the education system. So school time was lost, okay, because remember, many lockdowns also include travel restrictions, work restrictions, people don't go to work, and school restrictions, schools end up being closed, okay? So school time is lost, particularly affecting the poor more because the richer schools, everyone just goes online, right? And the unfortunate thing about school time being lost is that there are long-term effects, right? So a study actually showed that reducing schooling has been shown to decrease average earnings, okay, into midlife, into your 40s, all right, by 1.9% for women and 3.2% for men. Okay, so it's not just something that children will lose a year and then, oh no, they'll gain it back, they'll be fine, they'll be good. Studies have shown that there are long-term effects when schools had to be closed because of strikes or because of other types of epidemics. Okay, so there are long-term effects as well. And another thing is that a lot of the national exams, so for instance, even our matriculation exams, they were postponed, right? And I was reading in another article that for certain Cambridge exams, they were completely canceled, okay? So there are some devastating effects even to the education system. Continuing with some disadvantages of lockdown, people end up experiencing much poorer levels of mental health during lockdowns, okay? The levels of depression and anxiety did rise, okay? And this, of course, is linked to the fact that you have to deal with the physical threat of COVID-19. You're always on guard. During lockdown, you're trying to keep safe, you're trying to survive, you're trying to make sure that you don't get this thing. So that puts you in a constant state of panic, okay, and trying to just remain alive, okay. In addition to this, the lockdown process, okay, ends up leading to feelings of isolation, okay. People are distant from their support networks, from family, from friends, and there's just a general sense of uncertainty. There's an uncertainty of the future, and there's an uncertainty of whether this is going to happen and then it's going to finish and we're going to move on with life, or whether further restrictions are going to continue. Okay, so that also brings anxiety and brings depression. And depending on where a person is in their life, in terms of whether they have the job and they have the money and they have this and they have that, these issues will affect individuals more, okay, particularly individuals who don't have, who lack resources more than individuals that don't lack resources, okay. So, but mental health was a very big thing. I remember even last year, a number of programs were started not only for healthcare workers, because healthcare workers also experienced high levels of mental distress due to the high patient numbers and the pressure at work. But in addition to that, support had to be created for community people who have just higher levels of, depression, anxiety because of the whole lockdown. And of course, finally, then, the lockdown also ended up really making people have this sense that their freedom and their democracy was violated, right? So government control being at that very high level is scary and it's confusing, okay? Because you don't know, do they really have your best interest at heart or not, okay? You're hoping that they do, but you're not sure, okay? And in addition to that, people just felt that their freedom of movement was restricted, okay? There were traveling bans, we couldn't see family, we couldn't see friends. And I think also the coping mechanisms, so, calling via WhatsApp, starting to video call more than other things, meeting online, I think are coping mechanisms that came with time, okay? And also, and even those need resources, even those need a certain amount of privilege, okay? So so at the end of the day, people really felt restricted initially, okay? And individuals also just felt that their rights were being violated, that they didn't have to go through this. There was a lot of, government did get a lot of kickback from people in the community, people saying that the lockdown was unnecessary. Other countries had done it without the lockdown. Why didn't we try it without the lockdown? So, this is all an indication that people really value their freedom, value democracy. And when you get into this disaster management type of situation, people then feel that their freedom and their democracy is really being violated. Okay, so we are going to move on to the next issue, which is public mask wearing. Okay, and basically, this was enforced on the 13th of July last year, where the Minister of Justice and Correctional Services had a media briefing announcing that it had become a criminal offense not to wear a mask in a public space nationally within South Africa. So mask wearing also became mandatory while using, operating, or performing any service on public transport. And when you were entering any, public space or a building or any premise whatsoever. So what are the advantages of wearing a mask? Okay, so wearing a face mask helps prevent the spread of infection, definitely. Okay, when someone coughs, talks, sneezes, they could release germs into the air that may infect others nearby. And face masks prevent individuals from contracting any airborne infectious germs. Okay, so face masks have been part of infection control, okay, to eliminate any possibility of cross-contamination for years. As a health practitioner, I know this. We've worn face masks. It was mandatory to wear face masks as dentists, since we started seeing patients, okay? And I remember that even when we were still practicing on dummies, we would wear the face masks to practice with the face masks on, because if you get used to the face mask when you're still practicing on plastic teeth, then by the time you get into a patient's mouth, it's almost automatic that you'll know how to function, because you need to be able to learn how to talk with the face mask on, communicate, be able to do the procedure and everything. So the sooner we got used to masks, the better it was for us, okay? And so face masks have been used over time for as part of infection control, okay, for the longest of times, okay? However, the new thing was that this was now extending face masks to the general public as well. Okay, so what are the advantages of face masks? First of all, does the evidence support their use? Okay, in June of last year, 2 hairstylists in the USA, okay, who were wearing either double layered cotton masks or surgical masks while they were seeing clients, okay, in their salon, tested positive for COVID-19. okay? And the study shows that their household contacts were infected because at home they were not wearing masks, but their clients in the salon were all spared. None of their clients ended up testing positive for COVID. All right. So there is evidence to show that wearing of masks, be they surgical masks or even the double layered cotton masks, does work. Okay, that they do work. Okay. In addition to this, remember the Black Lives Matter protests that happened last year? We thought it was a scam, right? We get into the coronavirus pandemic, and then all of a sudden there are all of these Black Lives Matter protests across the USA, and we're thinking they're gonna catch COVID. That's what I was worried about. I'm like, no, this is not for me. Like I am I'm in solidarity all the way, but they're going to catch COVID. But apparently many of those protests, most of those protests did not trigger any spikes in infections, okay? And that's because majority of the attendees were wearing masks, okay? But in addition to that, just a contrast case that also happened in the US is that last year there was also a Georgia summer camp for children where it was not required for the children to wear face masks. And apparently in that Georgia summer camp, coronavirus ran rampant. So many of the children tested positive and having to be hospitalized. It was a mess. But it was just in one situation, in the Black Lives Matter protest, people were wearing masks. And in this Georgia summer camp, the children were not expected to wear masks and so didn't wear masks, okay? And then finally, there was a study that was done really across 196 countries, right? That showed that weekly increases in mortality, so in death due to COVID-19, were 4 times lower in countries where masks were the norm or recommended, as opposed to in countries where masks were not recommended and where masks were not the norm. Okay, so definitely, we have this case study in the hair salon. We have these 2 incidents of large groups, where people did wear masks and people didn't wear masks, and masks were shown to be effective. But even across countries where policies have been put in place either for the use of masks or not for the use of masks, right? In the countries where masks were mandatory, okay, mortality levels due to COVID-19 ended up being lower, which is amazing, which shows that definitely masks do work, right? So the question then becomes, okay, what is this optimal protection, right? How do masks work, all right? So optimal protection is ensured when all individuals in public are wearing masks, all right? But benefits are even present in partial compliance, okay? So this is a figure of the top 2 people. The first lady on the left, okay, is a COVID-19 carrier. She's not wearing a mask, okay? And the probability of transmission occurring is 70% to a healthy contact who is wearing a mask, all right? When the same COVID-19 carrier, okay, is now wearing a mask, the probability of transmission to a healthy contact who is not wearing a mask, okay, is only 5%. From 70%, it drops to 5% because that carrier was wearing a mask, okay? And then finally, when you have a COVID carrier wearing a mask and the healthy contact wearing the mask, the probability of transmission even falls further to 1.5%, all right? So it doesn't matter who's wearing the mask, definitely the probability of transmission, the likelihood of transmission decreases, okay? The likelihood of catching COVID-19 decreases. But when it's carriers wearing masks, the transmission decreases even less, okay, to healthy contacts. And when both individuals, healthy contacts and carriers, COVID-19 carriers are wearing masks, the level of spread even decreases further and transmissibility decreases further, which is good, which shows that masks are quite effective, okay. So, This is also a slide which shows, okay, because there's also this debate of, okay, but then what kind of mask? You know, are cloth masks even effective? All right, is the question, the golden question, right? And a study by Fisher et al. Last year actually looked at what is the relative droplet count, okay, that is seen in 10, okay, 10 experiments, okay, for each of these masks were done, and then the average was plotted on this graph. And we had all types of masks, okay, from surgical masks, all right, to cloth, to different types of cloth masks, to the N95, all right, some more different types of cloth masks, a knitted one, a bandana even, which runners use at times, okay, to not wearing a mask, all right, and then even having a fleece mask, okay, and all of the masks were better than not wearing a mask, first of all right, even all of the cloth ones, right? The only one that was very suspect was the fleece mask, okay? So we need to stay away from fleece masks, okay? Because the relative droplet count is exactly the same as not wearing a mask, all right? If you see on the extreme right of the graph, right? But everything else, that relative droplet count does decrease to be less than one droplet, which is great, all right? And if you're comparing things to the N95, so the N95 are even the masks that you use for TB, okay, those duck masks, okay? There are even some cloth masks which are almost the same and even more effective than the N95 masks, okay? But the golden standard, of course, is the surgical mask, which is why we want to keep the surgical masks available for health practitioners as part of PPE, okay? So droplet transmission through the masks, this study showed that, you know, it does differ according to what the mask is made of, all right, with the surgical mask being the most effective and the fleece masks being even less effective than not wearing any masks at all. So we really need to stay away from fleece masks, but everything else seems to be good, okay? Okay. So the next thing that we would like to look at is then what are the disadvantages of masks, okay? And first of all, if there's a limited supply, okay, of your health related masks, okay, so your N95 masks and your surgical masks, they really need to be reserved for healthcare workers, which I think is why, you know, many governments have said then we need to move towards the cloth masks, okay, because we really want to try and keep these masks which are for PPE available for health workers, okay, where they've already been shortages, okay. I think one of the biggest problems is that sustained wearing of a mask, okay, can lead to a skin condition, okay, which is known as maskne, all right? And this is a skin condition which is brought on by prolonged wearing of facial personal protective equipment, okay? So basically what happens is that masks will lead to heat friction and occlusion of the skin, closing off of the skin, okay? And when that is combined with a moist environment, for instance, when you're breathing, when you're talking, when you're sweating with the mask on, all right? This is a recipe for breakouts of pimples, right? So your pores get clogged and you then, and then they can become pimples and acne cysts, okay? And I've even noticed over time, okay, that I have more pimples around, you know, my facial area, my lower facial area, either underneath my chin, you know, or sometimes on my cheek. And I'm not a person who normally gets pimples. And I was wondering why all of a sudden is this happening? And I haven't changed my skin regimen per se. Okay, so I was really finding this to be strange. And and a friend of mine actually highlighted this to us on Facebook the other day. So this is a real thing, okay? And I think it's better to at least talk about it, people become aware of it, and also so that people then allay their fears and know that no, nothing's wrong with your skin. It's just because you're wearing masks more often. And because you're wearing masks more often, you then have to, you know, make sure that you're also looking after your skin a bit more. So prevention of maskne, you know, is about choosing a breathable mask, even if it's a cloth mask, but making sure that, there's more aeration, through the mask. Washing your cloth masks more regularly, okay, with perfume-free detergent, okay, because that can be irritating to the skin. Using less makeup, particularly if you are going to wear a mask, okay? So maybe, alternating days that you wear makeup, all right? Because once you put the mask on, most of the time the mask removes the makeup and rubs the makeup off anyway, okay? So maybe you can alternate days of using makeup, because makeup also clogs pores at times, okay? And then also just upping your skin regimen. So if you are doing your cleansing, your toning, your moisturizing, making sure that you don't just do it once a day, okay? But you can start doing that in the morning as well as at night. When you've removed the mask, you've removed your makeup, then you also just do cleansing, toning, moisturizing before you sleep, and using a lighter moisturizer so that your pores are not also clogged by the moisturizer that you're using, okay? So I hope those tips will just help you regarding this disadvantage. Okay. So we're going to be moving on now to washing and sanitizing of hands, okay, which was also encouraged quite a lot, all right, during the lockdown and during our time of the pandemic. So the Center of Disease Control recommends washing hands with soap and water whenever possible, because it reduces the amount of many types of germs and chemicals on a person's hands. This has particularly been advocated during the pandemic, okay? And if soap and water are not readily available, then using a hand sanitizer with at least 60% alcohol can help you avoid getting sick and spreading germs, including COVID-19, to others. Okay, so first of all, you're trying to prevent spreading germs from your hands to other people, but you're also trying to prevent spreading germs that may have gotten onto your hands and catching COVID-19 in that way, because once your hands then touch your nose or your eyes or your mouth, and your hands were in contact with the virus, then the virus enters your body. Okay, so you're trying to avoid that as well through repeated washing of hands. Okay. So what are the advantages of hand hygiene? Okay. And does the evidence support its use? Yes. Okay. So research shows that hand washing is not just effective in preventing transmission of coronavirus, okay, but it helps with other, diseases as well, to prevent transmission of other diseases as well. So an MIT study found that if 60% of travelers, okay, moving through airports worldwide had clean hands, the global disease spread could be curbed by almost 70%. So they did a modeling, okay, just to see how if 60% of the travelers had clean hands and were ensuring that their hands were constantly washed, in one way or another, what would happen? What would be the effect? And apparently, globally, the spread of the disease was going to be curbed by 70%. That's a high number, all right? Further, okay, the study also showed that if this rate could be maintained, okay, in only 10 of the busiest airports internationally, okay, 37% of infections could be prevented. All right, so about just over a third of infections could have been prevented if this was maintained in the 10 busiest airports. Okay, research has also shown that hand washing can prevent 20% of respiratory infections, okay, and over 30% of diarrhea related sickness, okay. So definitely this hand washing is useful, okay. It's useful to decrease the amount of spread from your hands to yourself, okay, so that you don't get COVID-19, okay, but also to prevent the spread from yourself to others, okay, which is really important, okay. Right, but what are the disadvantages, okay? Well, so first of all, repeated hand washing and sanitizing, right, can lead to losing moisture on your hands, okay, and losing the protective layer, okay, which can then dry out the skin, Okay. There's also a higher likelihood of cases of irritant contact dermatitis amongst hospital clinicians. So remember that when you're a clinician in the hospital, not only are you washing your hands, sanitizing your hands, but most of the time you're also using antibacterial soaps, antibacterial agents, in addition to just soap. Okay. And so because of that, the likelihood of health workers getting irritant contact dermatitis increases. Okay. In addition to this, sanitizers, okay, if we just look at sanitizers are flammable, because remember, the recommendation was that the sanitizer must have at least 60% alcohol, right? So sanitizers are flammable and are a fire hazard, okay? So you cannot leave a sanitizer in your car, in a closed car, in a closed area on a hot sunny day, because it just might catch fire. Okay. And I think there have been some videos on social media. I think some of them have been a bit fake news-ish, but you know, it is possible for sanitizer to catch fire. All right. And there was actually a test going around at some point that you end up knowing whether your sanitizer is real or not by, you know, striking a match to it. And if it catches fire, then at least it has enough alcohol. And if it doesn't catch fire, then it's not effective enough. Okay. And that's because of the alcohol content in the sanitizer. So we need to be mindful of that as we continue using sanitizers and leaving them in various areas throughout the day. Okay. And then just the frequent use of hand sanitizer. So remember that you have this alcohol-based hand sanitizer, okay, which can then wash away your skin's natural oils, okay, and that then causes drying and cracking of the skin. Okay, particularly if I know when you get into a mall. So when you get into the mall, you'll have a hand sanitizer at the entrance of the mall. All right. Then when you get into every single shop, there's also you know, someone putting hand sanitizer. Okay, it is insisted that you have to wear hand sanitizer as you enter every shop. So if you're going on a shopping spree, you know, throughout that day in that shopping mall, you'll have sanitized your hands at least 10 times by the time you come out of that mall. All right. And you just need to be mindful of that when you get home, wash your hands. You probably will have to, you know, strip and wash in totality. And then you also have to ensure that there's higher levels of moisturizing of your hands, because all of that sanitizing is not good for your hands. Definitely. 1, 2. Another thing is that the hand sanitizer can weaken the bond between artificial nail overlays and the nail bed. So particularly women who have, who do their nails, who have fake nails, okay, who put on overlays. So either gel overlays, acrylic overlays, silicone fiber overlays. You might have noticed over time that the overlays are flaking off faster, are coming off faster. And as a result, you have to see your you know, the lady who does your nails more often, because somehow your nails because the overlays just seem to be coming off more. And it's the same thing, because your hands are constantly being sanitized. That alcohol is interacting with the nails, and that is ending up weakening the bond that happens between the overlay and the nail bed. Okay, so just be mindful of that. And I've started seeing my nail lady, you know, every 2 weeks rather than 3 weeks, as I was doing before, because, you know, I just to be safe, you know, I know that within 2 weeks I should be due for another appointment. Okay, so the next section that we're going to look at is then social distancing, self-isolation, and quarantine. Okay, so social distancing is the practice of maintaining a greater than usual physical distance, okay, about 1 meter to 2 meters, okay, from other people, and avoiding direct contact really with people. And why would we want to do social distancing? So COVID-19 spreads when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air, okay, and land in the mouths or noses of people nearby, or hands or bodies of people nearby. And then you touch yourself, and then you end up getting coronavirus as well, okay? So social distancing therefore would prevent this second part, all right, of the process. So you would hopefully be far enough so that when a person coughs or sneezes or talks and is infected, okay, those droplets don't end up landing on you, basically, all right? This is a little bit different to self-isolation, okay, which is a voluntary act of home-based quarantine, okay, by any person who might or might have not been exposed to COVID-19 to contain the possible spread of COVID-19. So people with no COVID-19 symptoms, but who have tested positive, must remain in self-isolation for 10 days after they get their results, okay? In addition to this, people who have a mild case of COVID-19 need to isolate for 10 days as well, from the day that their symptoms started. Okay, that's if you have a mild case, all right? And then this of course was the recommendation that was changed from 14 days. Initially it was 14 days, now it's been decreased to 10 days, okay? And then people who have a severe form of COVID-19 infection should end their self-isolation 10 days after they have been declared clinically stable. So 10 days after their symptoms start being mild, okay? In other words, after they are no longer on any oxygen support, then from then on, they need to be in self-isolation for a further 10 days, okay? And the scientific basis for self-isolation is that the COVID-19 infection continues to shed the virus from the upper airway, okay, the upper respiratory tract, for approximately 7 to 12 days. So at least you're hoping within 10 days that process will have ended. And remember, it's an average. So some people take 7 days, some people take 12 days, but more or less, many people will be taking somewhere between 7 and 12 days. Okay, and you're hoping that after 10 days, people are not shedding the COVID-19, the coronavirus from their upper respiratory tract, from their upper airways anymore. And so they won't be able to spread it, even though they may be asymptomatic. They don't have any symptoms anymore, but then they won't be able to spread it to others anymore after this 10 days, is the thinking behind it, okay? Okay, so this is all different to quarantine, right? So quarantine is the separation and restriction of movement or activities. The separation and restriction of movement or activities of persons who are not ill, but who are believed to have been exposed to infection for the purpose of preventing transmission of diseases. So you get a COVID scare, we call it, right? You realize that somebody tells you at work that they tested positive, okay, for COVID, all right, and so you put yourself into quarantine, all right. Also sometimes also at times with the whole travel, okay, with the whole traveling, when people were coming back into the country, okay, from various countries, they were put into quarantine, all right, for a certain period as well, to make sure that they did not display any symptoms before they were allowed to come into South Africa, okay. And persons are usually quarantined in their homes, okay, particularly if you have a COVID scare if the app notifies you, you then just quarantine at home. But they may also be quarantined in community-based facilities. So a lot of hotels were offering their facilities for quarantining of individuals, South African individuals coming back into the country who wanted to come back home during lockdown, okay? And then also the possibility is there for self-quarantine, okay? So people who have had close contact with a COVID-19 positive person, okay, but not yet developed symptoms or tested positive, should self-quarantine for 14 days. So even if you don't get tested yourself, but you know someone else who did get COVID-19, okay, and did test positive, then you can go into self-quarantine for 14 days just to make sure, are you okay? Do you end up experiencing any symptoms? If you do, then you treat yourself symptomatically and you know, you just wait until the 14 days are over, and also the treatment course is also over, okay? So what are the advantages of all of these types of physical distancing, okay? And this is where it becomes tricky, because some of the evidence supports all of the physical distancing, and some of the evidence doesn't support it, okay? So a study by Chu showed that social distancing was associated with a large reduction in infection with coronaviruses at distances of at least 1 meter, all right? But of course, this social distancing was even more effective, all right? And there was even a larger reduction of infection when this social distancing occurred at 2 meters, all right? So that's why there's this, this range again of 1 meter to 2 meters, okay, of social distancing. Because some studies have said that 1 meter is enough, but other studies have said actually you need more than 1 meter, okay, for optimal reduction of infections, right? And then Jefferson et al. Found that there was insufficient evidence to support social distancing measures to prevent transmission of respiratory viruses in general, okay? And finally, Fong in 2018, so this was even before coronavirus, okay, found limited evidence that social distancing measures reduced transmission in influenza pandemics, okay? But just because, this was the case for influenza pandemics doesn't necessarily mean that it's the case for coronavirus. It's just because many of these diseases are very similar, okay? And a lot of extrapolation has also occurred from other respiratory tract airway viruses and for assumptions to be made for coronavirus. So what we can then conclude about the various forms of physical distancing is that social distancing is effective when it's used in conjunction with other NPI measures. Okay, that is definitely something that we can say at the end of this. And so I think we have a good story to tell in South Africa to a very large extent because we have used many of these things in unison. Okay, but then we move on to an area which is very concerning, which is the role of inequality in the success of NPIs during the pandemic, right? So the effectiveness of NPIs, of non-pharmaceutical interventions, is dependent on how effectively individuals, okay, many individuals are able to correctly, okay, apply and adhere to them, all right? And the unfortunate thing is that to correctly, okay, adhere to the non-pharmaceutical interventions, other things end up being at play. So for instance, socioeconomic inequality, okay, causes certain dynamics, all right? For example, lockdown was enforced, all right? But many poor South Africans live in homes with high household numbers. So if you're living in a household, if you're living in a home, let's say of 3 rooms with 8 to 12 people, okay? It's fine, lockdown has happened and you all have to be now at home. But first of all, it's not going to be easy for you to remain in that home, when you're 12 people. And so people are going to want to come out of the house, all right? People are going to get restless. People are going to be on top of each other, okay? People are only used to being together in the house when it's time to sleep, okay, at night, all right? And now lockdown has brought an unusual situation where people have to be together throughout the day. It's unsustainable, all right, in certain environments, okay? And that's why that's why the army was called out to support the process of lockdown, but the army was sent to certain areas where the risk, of people not adhering to lockdown was higher. All right. And at the same time, as much as that was done to support the community, because the army was also dealing with poor South Africans, because the army was dealing with individuals that have fewer resources, individuals that are in these desperate situations, at times the situations became very explosive, okay, with devastating effects, unfortunately, okay. In addition to this, many individuals ended up returning to work even during lockdown, okay, in order to continue earning an income to survive. So so even if it's during lockdown, but if your employer calls you and says, listen, I've been able to get permits for us to continue working, okay, even though lockdown is happening, all right, we've been able to change the company into an essential services company. You're not going to stay at home and say, oh no, boss, I want to be safe. You're going to go back to work, all right? And another thing is that many areas in South Africa have not had a steady supply of water for decades. So the whole hand washing, okay, initiative that was out there was great, beautiful. But if I don't have water, if I don't have a safe, steady, reliable source of water, I'm not going to be washing my hands 20 times a day, okay, as government would like me to do, all right? Um, and finally, many South Africans just live in crowded areas. You know, we live in a society where not everyone is able to be in the suburbs, okay? And the majority, and this is the majority of people, the majority of people don't live in the suburbs. The majority of people live in squatter camps, slums, areas which are incredibly crowded, townships, okay, where social distancing is just impossible. You want to do it, okay? You've been advised to do it, okay? It is a lovely option. It is just not possible because because people's homes are on top of each other, because people live so close to each other. All right. And I think it was important for us as a nation, for us as a people, okay, especially in developing countries, to be mindful of these socioeconomic inequalities. Okay. In addition to this, there are also gender inequality dynamics, all right? So for example, although the coronavirus occurred higher amongst men initially, okay, this quickly changed, okay? And it quickly changed for a number of reasons, okay? It quickly changed because women in South Africa make up a significant proportion of the essential working force. So even when lockdown happened, okay, those women not going to work was not an option. They had to go to work. Okay, they were part of the essential working force. Okay, and if you're going to work, that means that you are increasing the likelihood of exposure to the virus, because the virus is out there. Okay, so you're going to definitely get it somewhere. Maybe when you're in transit, maybe when you're at work, somewhere. Okay. In addition to this, women are also primary caregivers in the home. Okay, so they would be exposed to anyone who contracts coronavirus and brings it into the home. Okay, and also it's impossible to maintain physical distancing if they need to care for and feed a sick person. And most of the time it is women that end up caring for and feeding the sick. All right. And so we talk about all of this isolation and quarantine and but as a mother, okay, you can't, although your child might be self-isolating, all right, although your child might be in quarantine, you're going to even think that the responsibility, you're going to have an obligation, you're going to feel that you have an obligation to make sure that the child still eats. Okay. And that means that you need to prepare the food. You need to make sure that the child is okay. You need to care for the child. If the child ends up having a fever, you have to look after the child. You have to ensure that the fever breaks, okay? Which is going to need contact. So you might end up getting the virus yourself. This is the same thing that happens when mothers are raising children and the children end up getting your normal flu. Okay, the mother will end up getting the flu. It's inevitable, because as you're looking after the kids, the kids will end up spreading the flu to you. And sometimes the unfortunate thing is that there can be cycles of the flu transmission. So your child gets it, maybe let's say from creche, brings it to you, okay, home, you need to look after the child, then you catch it, then once you catch it, you take it back to the child, then so this is just the role that women have in society, that we need to be mindful of, that therefore their risk of exposure and their risk of getting the coronavirus are actually then higher. Okay, so levels of infection currently, okay, are higher amongst women. We are lucky as women that our levels of mortality, that our death rates are not higher than men, but they are almost equal. I think it's sitting at 51%, 49% currently. Okay, so So almost there, but at the end of the day, there have been studies that have shown that there are other reasons that are occurring that have continued the mortality rate being higher amongst men. Okay. But things to be mindful of and things to be aware of as we continue in the pandemic, wanting to ensure that we have universal health care. And how do we ensure that the points of care are really spread across evenly to all forms, to all parts of society, regardless of socioeconomic status, regardless of gender. Very important. Okay. And so we now want to look at, what these the challenges that behavioral change always bring about. Okay. There's always a challenge in sustaining behavior change. Okay, this is a particular field, okay, a whole science, a whole field that is looked at, that is investigated. Okay, and in addition to this, there's COVID-19 fatigue. Okay, eventually causes non-compliance. Being restricted for long periods of time, hearing about COVID-19 repeatedly, hearing about what you must do, where you must go, why you must do this, da 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 da. People get tired. People get tired. And when people get tired, the likelihood of then relaxing and not complying with the recommendations then increase. Okay. So this would lead to a second wave. And the same thing happened during the Spanish flu outbreak in the 1800s. Okay. I gave a lecture on the similarities between the Spanish flu and the COVID-19 pandemic. And one of the things that I stressed the most was that after the lockdown was lifted for the Spanish flu outbreak, people were excited, people ran into the streets, hugged each other, were so happy, and there was another wave, and started the second wave of the Spanish flu. Okay. And my biggest warning was that when it comes to the coronavirus, we need to make sure that when the lockdown is lifted, we don't do the same thing. We don't end up being so excited and that we let down our guard, that we are not cautious when we go back into public. Okay. So additionally, many NPIs require us to behave in ways that we are not traditionally used to as people, okay? Particularly people residing in Africa, okay? As Africans, we are incredibly social beings, okay? We are social beings, we like being together, so lockdown restricted this heavily, okay? In addition to that, as Africans, we do not shy away from physical contact, we do not shy away from hugging, clapping each other on the back, being together, consoling each other, putting an arm around another one's shoulder. So social distancing, okay, and recommendations against handshaking, against hugging, okay, have hampered all of this physical contact that we are so used to, okay, even at just the platonic level, okay. And then masks also limit our ability to communicate and converse freely, okay, which is also a very much a part of our society and a part of the things that we do, okay. And finally, a study was done which showed that 20% of South Africans washed their hands with soap at critical times, okay, such as before, during, and after preparing food, after going to the bathroom, after sneezing or coughing, after touching animals, after changing. Only 20%, 1 in 5 South Africans wash their hands before and after these critical times, okay, at these critical times, all right? So you can see that it's not in our nature to now start washing our hands multiple times a day when we see that we've now done this, or we've sneezed, or we've coughed, or we've done, it's not in our nature to do that. So that requires a very, behavior change, but behavior change is more sustainable if it happens slowly over time. If we do something drastic, it's going to be easier to come out of those habits because you have not built the habit over time, okay? So going forward, okay, in conclusion, what are the things that we need to concentrate on? I think the biggest thing that we need to concentrate on is that it's important for advisory teams, okay, people that are advising government and other people that are trying to put strategies into place. Those advisory teams should not only consist of health experts. Health experts are important. Health experts are great, okay? But you also need social science experts because you're now dealing with human behavior. And it is only the social science experts who are going to be able to explain to you, to, you know, predict how humans are going to behave in that situation. So people like your psychologists, people like your sociologists, people like demographers, you need them on board, okay, to be able to advise, okay, and to able to work together with your health experts, your epidemiologists, okay, your virologists, okay, to come, and your public health specialists, all right, to come together to find middle ground that, okay, this seems to be a bit too too much too soon. Okay, let's try another option. Why don't we do this? Why don't we implement this in stages? Okay, so those are the kind of debates that we need to start having amongst the health experts as well as social science experts. Okay, but also going forward, we need to have an approach that is more people-centered, okay? An approach which is more people-friendly, okay? An approach which is going to be more sustainable over time, okay? Where individuals are equipped and motivated to support each other in safe practices collectively, okay? When you equip and motivate people to support each other collectively, the burden of the new things all happening at the same time is going to be decreased because the support is there, okay, at a higher level, okay? So such practices should be emphasized using concepts and values that local communities already understand, okay? Things like Ubuntu, things like umuntu ngumuntu ngabantu, okay? That I am who I am because of other people, okay? If you spread that kind of message, it's not a foreign message, you know, amongst Zulu people, amongst, you know, people living in South Africa, because we already have that ingrained in us, okay, as part of our way of being. Okay, so that's what you need to do. You need to build on people's current ways of being already, rather than shocking them with new things that make them have to completely change their behavior patterns. Okay, rather build on what they already know and create support networks so that people feel that they are not in this alone. Okay. So the final thing that I'm going to try and stress is this importance. One of the things that was raised as one of the lessons that we could learn from HIV, right? That there was an importance of mutual interdependence in COVID-19. I am dependent, okay? My survival is dependent on other people adhering, okay, to the various regulations. And their survival is dependent on me adhering to the various regulations as well, all right? So we had an initial government reaction, right? An initial government action which led to anxiety amongst people, okay? We thought that it was too institutionalized. There was too much power that government had. They were telling us to stay at home. They were ordering us that we had to be in lockdown. This just caused anxiety and caused depression and caused panic, okay, to a very large extent. People just didn't know and didn't understand what was happening, okay? But we need to change that to a more pivot prevention approach, okay? Where people end up having agency, people end up having the choice, okay, to decide, okay, that and realizing that power is within them, that power, that they hold the power, okay, that it's about when I go out, I'm going to wear a mask because I want to keep safe, but I also want to keep others safe, okay? And public health interventions, all right, are also important, so that people, and so that we normalize these things that are happening, and it's seen that it's not only certain groups that this is happening to, but it's happening everywhere, it's happening around us, and then it becomes more and more normal. Okay. And this will hopefully lead to subsequent individual action. So self-efficacy, okay? So individuals being motivated themselves, okay? So the power to act for prevention, okay? Personal, okay? Power to act for prevention. And when everyone is doing that within a community, okay, there's then collectivism, okay? There's then a collective community action, right? So motivated communities, there's then the power for collective action, and there's this sense of Ubuntu, this sense of I am because you are, this sense of how can I support you for you to do what you need to do more, okay? That's what we are hopefully moving towards more and more. Okay, I'm hoping that as much as this has been an incredible ordeal, all right, with us having to learn many things all at the same time, okay, we are moving towards a space where we support each other. We support each other through finding out how we can do online meetings rather than face-to-face meetings. We support each other by finding out how I can help a neighbor's child with their schoolwork if the neighbor can't go to school. Okay, can I share my password, my internet password, which is, which is free for all, can I share it with others, and other kids, they can then go to school online or be doing videos online or doing something online. Okay. What can I do to help my community? What can people in my community to help? What can they do to help me? I know that in my community, we have a neighborhood WhatsApp group, and it flourished within lockdown, and there has been an incredible sense of solidarity within our neighborhood since lockdown began. Okay, so definitely people are seeing the value, where we even where someone can say in the group that, guys, I was about to make a cake, but I've run out of baking powder. Does anybody have baking powder? They put it in the group, and people are like, I've got extra baking powder, I can help you. So just knowing that although family might be far, you have neighbors. This is not the most normal of things in the suburbs, right? It's normal in townships, it's normal in other settings, but in suburbs, not so much. But this has been a learning curve for us to realize that we only have each other to depend on, okay, particularly during lockdown. So let us work together. Let us know that we are each other's keeper rather than being each other's enemies. Okay, so this has helped incredibly. And we are moving more and more towards this mutual independence that is encouraged, okay, at this point. Thank you so much.
Thank you so much, Dr. Mkwananzi. We are really, really grateful for this important conversation that you've started, especially considering what is happening in the world, what is happening when we're thinking of, so the social solidarity that you are talking about. And there's just been so much conversations in the chats, like people being very grateful for your presentation and the information that you're sharing. I just want us to start with the questions. I think one of the first questions that is here is from Lynette. Welcome back, Lynette. Lynette was with us yesterday. She's thanking you for a powerful presentation and eloquently delivered and very accessible. Why the 14 days quarantine period? Now that we have SARS-CoV-2 variants, will the quarantine period time frame increase or decrease? That's question one. I'll give you two questions, Doc, so you can tackle two at the same time. Another one is from somebody who's anonymous. Could leveraging on TB infection control measures in congregated settings, that is opening windows in the taxis, opening windows in the classroom, or in places where they inevitably congregate. The people congregate. Help as a non-pharmaceutical intervention for COVID-19.
Okay. So let me start with the first one. So why 14 days? 14 days, it was initially 14 days. It's now been decreased to 10 days, okay? Because the virus is said to be able to shed. So you're still able, so you might not necessarily be sick anymore, all right? But you're able to still release the virus when you talk, when you cough, when you sneeze, if you're positive, okay, from your upper airway, all right, for 7 to 12 days. So it was initially 14 days because they wanted to cover that 12 days, but it's also shown that as those days go by, the shedding decreases, the percentage of shedding decreases until it's almost negligible. So 10 days is like a safe in between period. For people to know that after 10 days, even though they've had the coronavirus, okay, they are not still spreading it when they talk or cough or sneeze. Okay. And then, yes, leveraging on TB measures, prevention measures would assist greatly. This is why government has also advocated for, gatherings to move from indoor spaces to outdoor spaces, all right? So that there's aeration, so that there's, so that there's just, and also space, and also the ability for social distancing, of course, outside is higher, okay? But definitely opening of windows would be useful, okay? Physical distancing, okay, with even if you're indoors, and also trying to make sure that there are fewer people in that enclosed environment would be really helpful, definitely.
Thank you again, Doc, for answering those. I'm just reflecting also, I'm reflecting on your presentation, and you said something around that part of dealing with COVID-19 is the Ubuntu, understanding that we are because of each other, as the saying goes, that it takes a village. And yesterday when we were speaking also about vaccines, and that taking a vaccine is a solidarity. It's not necessarily a selfish act, but it's a solidarity. And my former editor used to say, Lara Lopez Gonzalez used to say, vaccines are social contract. And so is washing your hands, so is wearing a mask, so is making sure you're not standing close to someone when you're in a shopping mall. Those are ways in which we can, particularly when we think about the non-pharmaceutical interventions, there are ways in which we can phrase it that brings people into the conversation in a way that does not sound or feel paternalistic, and almost like the government is forcing me to do this. When we communicate these measures in ways that bring people in and show people's collective responsibility instead of a very militaristic and paternalistic approach to them. There's also more questions, and then I will take Wilson, whose hand has been up, but let me take 2 questions before that. Another question is, do you recommend that we stock up on our own oxygen supplies privately for our homes, especially seen as though there are such shortages of oxygen in hospitals? The second question is, what is the role of traditional herbal medicines such as umhlonyane, lingana, or as it's known in its English name or its Latin name, Artemisia afra, in preventing COVID-19? Many families are taking these herbal medicines as a precautionary measure.
Okay. So maybe let me first talk about the stocking up of oxygen. For me, that sounds a bit extreme. Okay. Hopefully what you would want is, let me say up front, I've had COVID, all right, already. Okay. And what you're hoping for is to, even when you do get it, right, to have some form of symptomatic treatment that is so effective that you don't get to the stage of needing oxygen. Definitely, that is the go-to, all right? But even if you do need oxygen, you know, what's this? Using oxygen is not the easiest of procedures. Okay, you need training for it. You need to make sure that the concentration levels are correct. You need to make sure that you do it in a way that causes, you know, relief rather than harm in any way. Okay, and so unless you're medically inclined, I really don't think that it would be the best thing to be stocking up on oxygen. And additionally, oxygen is needed by the hospitals, right? Oxygen is needed by the masses out there who end up getting to the hospital and needing to be put on ventilators, right? So I would prefer and be more comfortable with us doing what we can do in our homes, all right? And if push comes to shove, going to the hospital, getting an ambulance, going through to the hospital, and being administered oxygen at the hospital level. That's what I would be more comfortable with, honestly speaking. Okay. Traditional measures. This is a very contentious topic. And it's contentious, I think, because the WHO and the who's who, all right, out there have been very against many of these traditional measures. I'm not against the traditional measures, I must say, personally, all right? I personally have done quite a bit of research on Umhlonyane. As you can see, even through the preparation of these slides, whenever I need to speak on something, want to do some research on something, I go and I look at scientific evidence, okay? And there is already scientific evidence that states that Umhlonyane Artemisia has been used traditionally over time to support respiratory infections, all forms of respiratory infections, even your common flu, all right? And so based on that, even though they might not necessarily be treatments, because of course we would need clinical trials for treatment, for a statement for us to say that they're definite treatments, right? But their use in being able to assist with the symptoms that people have has already been proven over time within our communities, particularly in rural areas and in areas where these traditional measures have been used over time, all right? So I'm not against them, all right? I've not spoken about them in the lecture, all right? For reasons, because what was advocated were all of these measures, all right, at a national level. But I do know, okay, and I have spoken to people within communities, all right, particularly the lower people living in lower socioeconomic settings, that yes, the traditional measures are being used and are being found to be quite effective. And I think, therefore, a framework needs to be put in place where clinical trials will be started, and these things will be tested, so as the scientific backing and evidence that is needed for us to state that Umhlonyane definitely does work ends up being present. So I'm not against them, and I think we need to do clinical trials, but at the same time, I would not force them on people that may not be comfortable to use them as well. Yeah.
Thank you, Dr. Mkwananzi, for that. And also just to add a little bit on traditional medicine, as something that I've followed quite closely in my career as a health journalist is the intersection of traditional medicine and HIV care. And there's been lots of research that's been done, case studies particularly in South Africa, in the KwaZulu-Natal province, which is the South African, that's where there's the highest population of HIV positive people in the country. And I've interviewed traditional healers who have been trained through a partnership between traditional healers and government and civil society, who have been trained in HIV literacy. So when a person in their community comes in for a consultation, they also have been trained, they're almost like community healthcare workers. They're able to perform HIV tests, they're able to do pre and post counseling of HIV tests, and help their patients and their clients in order to merge the two, you know. So this is not, there is a space for traditional medicine within the framework of public health. However, the relationship is a very delicate one and needs to be managed in a very delicate way as well. I remember one of the traditional healers who does the HIV testing, what she said to me, she's like, you cannot, it is very hard to want to put a non-Western concept of medicine into a framework of Western science, and that traditional medicine, Western medicine are not enemies.
Sure.
They can complement each other, but with evidence, as you're saying. So I think that was a very interesting discussion, and it's a discussion also related to non-pharmaceutical interventions that we need to think about, that activists have brought up, thinking around when restrictions on funerals were made, where African traditional ceremonies of how people bury, how African people bury, or people of different cultures and spiritualities bury their loved ones, were those taken into consideration when measures for funerals during COVID were being made across the world. These are some of the things that are non-pharmaceutical, and they need the social scientists, they need the activists in order to happen. Anyway, there's many more questions for you. Daisy Mafubelu is asking, we're advised to cough into the bend of our elbow, but some also encourage us to elbow greet. Will this practice not promote transmission of the virus? What is your view on this? I'll ask you 3 questions, Doc, because I'm looking at the time, and also the fact that we still have another lecture. Ownership and responsibility. Togozile Mtolongo says, ownership and responsibility of our own health and consequences has become more important to emphasize and put into practice more now more than ever. We need to drive these messages forward in our advocacy in our communities. That was not a question, more of a comment. Thank you so much for that comment. Doc, hold on to the elbow question. Here's another question from Moses Simwayo. How can governments across borders, especially Beitbridge, respond to the super spreaders, border jumpers? And the last question, I have had COVID and now I suffer from lung issues. I'm now on an inhaler. I know that there's an increasing evidence showing post-COVID-19 people suffering from all kinds of crazy post side effects. Is it late onset asthma one of these? Those are the questions, Doc. Go right ahead.
Okay, so so the elbow issue. So I think the spread of the virus from people coughing into the inside of their arms, but then greeting with the outside of the elbow, I don't think it would increase the level of transmission. Okay, I think it was going to be. I think the level of transmission is, and also because from coughing inside your elbow to greeting with the outside of your elbow, but both parts of your elbows aren't able to touch your eyes, your nose, or your mouth. Okay, as opposed to coughing into your mouth and then and then from your hand, I'm sorry, into your hand, and then you touch your eyes, your nose, your mouth with your hands. And also when you handshake people, you also then spread what you were coughing, right? So the risk is still much higher when we cough into our hands, okay? And although there might be, something that we could think about, perhaps a study needs to be done. As a researcher, this becomes my go-to, of what the transmissibility is, what the risk is really, in a person having coughed and then greeted with the elbow, and then the likelihood of that person getting COVID from someone who had greeted them who was positive. Okay, because also remember, we're wearing masks. Okay, also remember, we have clothes on, and it is advised that when we come back from and also when we come back from being outside, from being in public, we come back, we remove our clothing, we take a bath, we wash the clothing. So all of that should then prevent the risk of transmission going forward. Okay. Someone is suggesting that we need to cough into one elbow and greet with the other elbow. That might also, that would definitely also decrease the risk and the transmissibility. Okay. Ponzo, can you remind me of the second question quickly?
Yes, Doc, I can remind you of the second question. It was somebody talking about could long haul COVID. Let me just read it again.
Yes, long
I've
haul
had
COVID, right?
yes.
And the effects of that, right? So yes, I think I've been very fortunate that I have not had long-term effects from my own experience of the virus, of the infection. Um, I don't think it would necessarily be, asthma, right? I don't necessarily think that it would be asthma that is now, being created, right? But the problem is that once you do get COVID, it is possible that because of also the extent of the virus, so the extent of the disease process, if it end up getting into the lungs, it can end up damaging parts of your lungs. And if your lungs are then damaged, then going forward, um, breathing can become difficult, um, and that would then cause some of the symptoms, I think, that were being raised. Okay, so not necessarily asthma, but from the actual disease process and progression having gotten to an extent of having entered the lungs, because COVID starts in your mouth, nose, goes up into your upper respiratory tract, uh, airway, your upper airway, and then starts descending into the lungs. And you can literally feel the different stages, because when it's in your nose is like burning, people lose their sense of smell. As it goes up into your upper respiratory tract, while also at the beginning you have incredible headaches because it's in your sinuses, so everything is going up there. When it gets into your throat, a lot of people talk about a symptom of like swallowing glass. It's like you're swallowing glass. Luckily, I didn't have that symptom. But once it starts getting into the lungs, you hear crackling, you hear a noise, especially when you're lying down. When you're lying down, you can hear crackling noise, like as you are breathing. Okay, it's one of the most scary sounds. Okay, but that then also shows you how the disease is progressing and how far the disease is. So these are the things that we need to be mindful of and pick up, so that we try to prevent all of these stages. And what I would definitely recommend is that, yes, we need to be ensuring that we are having all of the symptomatic treatments. A lot of the medication out there, antibiotics. Remember, antibiotics are not to combat viruses; they combat bacteria. Okay, so even if the go-to is azithromycin, or other people are using hydrochloroquine, these are really to combat bacteria rather than viruses. Okay, and this is and bacteria would be secondary infection. Okay, not being able to deal with the actual virus. Okay, but in addition to this, we need to also be treating symptomatically, making sure that we have our Vicks, our Medlemon. Other people are using steaming with Vicks. Steaming with mhlonyane is also quite helpful for other people. But also, one of the greatest symptoms with COVID is increased fatigue. People are very fatigued. Okay, you become very tired, and you become tired for very long times. Okay, for a very long period. Okay, you're not sure why you're tired, but you wake up tired, you go to sleep tired, kind of thing. And what has helped, what I've seen actually helps with that is sun exposure to the sun. And sun exposure helps because that then helps you to increase your levels of vitamin D. And when you have low levels of vitamin D, most people actually are now having low levels of vitamin D because we've been in lockdown for a very long time. So people have not been getting a lot of sun exposure. And so but if you do get tired and you go into the sun and you get exposed to the sun, that then increases your levels of vitamin D, which will then decrease your levels of muscle fatigue. Okay, they'll decrease muscle fatigue and just give you, a better sense of well-being. So I really would recommend spending some time in the sun, at least an hour a day in the sun, 30 minutes in the morning, 30 minutes later on during the day. Okay.
Thank you so much, Doc, for that incredible, informative, thoughtful, thought-provoking presentation. When we think about non-pharmaceutical interventions, and in the absence of enough vaccines at the moment, all we do have is non-pharmaceutical interventions. All we do have is relying on each other, the social solidarity of social distancing, the social solidarity of wearing masks properly, covering our mouths and nose, and also understanding very cognitively the limitations that are there for people to be able to, for instance, say quarantine, isolate, and also the gender perspective that you talked about because of the burden of care being on women. It's women who the non-pharmaceutical interventions sometimes don't work in their favor. And that's not because they don't care about themselves, they're not taking care of themselves, but it's because of the fact that of the realities that they face. Also realizing that people have to take public transport and many, many reasons that hamper the success of non-pharmaceutical interventions, that is not just about personal responsibility or people being careless, which is sometimes the narratives that we want to focus on. Again, I'd like to thank you, Dr. Sibusiso Mkwananzi. Thank you everyone who's asked questions, interacted. It's been as wonderful as it was yesterday. And I can't believe in just 15 minutes we'll be starting our last lecture. Maybe we should have these every month because we could learn so much. Maybe not just COVID, we should have them about everything and anything, but we'll see. So I would suggest that do not log off like we did yesterday. Do not log off. Just maybe go on mute or go take a walk and stretch, because we've been sitting down for 2 hours and we spend all our time on Zoom now. And it's important that we just move our bodies a little bit. If it's dinner time, go warm it up and bring it to the screen. And we will see you in 15 minutes when we begin Dr. Samgeliso Dube's lecture on the basic sciences of COVID-19. Thank you again, Dr. Mkwananzi, for a thoughtful and knowledgeable lecture.
Thank you so much.